This is a presentation about epilepsy by Fabio Ciarrocchi. Good morning, afternoon, evening. Thank you for having me here to speak to you today. We will be discussing a disorder that affects millions around the world, including my wife, who's been diagnosed with epilepsy. According to the World Health Organization, up to 1% of the global population suffers from epilepsy. We will discuss the fundamental basics that make up epilepsy, including signs and symptoms that might enable you to recognize anyone that might be affected by the disorder. To fully understand epilepsy, we first need to review the basics. The nervous system is divided up into two parts: the central nervous system, consisting of the brain and spinal cord, and the peripheral nervous system, that consists of the nerves that relay on information from the CSS to the rest of the body. The brain is the central vital organ that controls all the body function and communication with the rest of the body. Messages need to be transmitted through nerve cells or neurons. These messages are transmitted through regular electrical impulses. In epilepsy, there is a disruption of the normal patterns of these neurotransmitter messages, and bursts of electrical activity in the brain can cause involuntary muscle movements, changes in awareness, sensation, and behavior. Now that we understand how neuron transmission is supposed to work on a cellular level, we can move on to the description of epilepsy. What is epilepsy? It is a neurological disorder affecting the central nervous system. It is a disorder in which an individual can experience recurring seizure activity due to a disruption to the normal electrical chemical activity of the brain. In this stage of the presentation, we should review common key phrases. Epilepsy is a disease associated with spontaneously recurring seizures. A seizure itself is the action or event, and it can happen with or without muscle convulsion. To further emphasize the definition of epilepsy in the previous slide, a seizure occurs when there is an electrochemical disruption in the brain which intercepts the message. Epilepsy can be divided into two general categories: focal and generalized. The picture on the right that shows the generalized brain versus a focal seizure, which I'll go into more later. This categorization was established to identify the onset, or where in the brain the abnormal electrical pattern starts to occur, as a location of where and what part of the brain is affected can have varying signs or symptoms. For the focal seizure, it affects one side of the brain, or one hemisphere. It's described by the area of the brain in which they originate. It used to be called a partial seizure due to the electrical activity occurring and staying on one hemisphere. The slide on the right shows the divided hemisphere of the left brain, including the frontal lobe, the parietal lobe, occipital, temporal lobe, and cerebellum. I put this on there to show that a seizure activity in one part, or a certain part of this aspect of the brain, can affect anything from muscular movement, communication, sense of smell, sense of taste, vision, and understanding language and memory. And then a focal seizure can even be divided further based on awareness or motor function that is involved. For the generalized seizure, it's the most common one. It is the uncontrollable discharge of the neurons affecting both sides of the brain. Generalized onset seizures almost always affect awareness in some way. So compared to focal seizures, it's usually divided based on movement itself, or the convulsions in this case. So there's the absent seizure. It's a sudden lapse of awareness and responsiveness that looks like brief staring spells or daydreaming. Versus your tonic-clonic, it's when you see in the movies the body stiffening, the tonic phase toward the body, and the limbs begin to jerk dramatically away from the body, which is the clonic phase. And then there's also the simpler myoclonic, which is like the singular jerks of muscle or groups of muscles that may last no more than a second or two. And then further along in this category, you can see that there's another diagram, which is the unknown onset. So to go back on everything, there's the focal onset, a generalized onset, and an unknown onset that could have the tonic-clonic or focal to generalized. And then after the description of seizures, you go forward into epilepsy itself and how you diagnose it. So this is where epilepsy is determined based on the type of seizure involved, which is why we went over all those slides. In this slide show, epilepsy is also divided into the generalized, the focal, combined, generalized, and focal, or an unknown category. Basically saying that because you have a generalized seizure, you're probably going to have generalized epilepsy. Focal seizure affecting partial or one side of the brain can go into a combined and generalized focal one, or unknown epilepsy is at this time we don't really know what is causing your seizures, so we need to monitor you further to see if you have a second seizure so we can pretty much diagnose you. So the criteria for epilepsy is, disclaimer, not every seizure is a sign of epilepsy. To be classified as epilepsy involves the following: at least 2 unprovoked or reflex seizures occurring within 24 hours apart, 1 unprovoked seizure, and a probability of further seizures similar to the general recurrent risks after 2 unprovoked seizures occurring over the next 10 years, or a diagnosis of epilepsy syndrome, which is basically strong genetic disposition. The key phrase I want to emphasize here is the word unprovoked. That's pretty much going to be the key word that determines the correlation of seizure activity, as anything else can probably cause a seizure. There be head trauma, substance abuse, withdrawal, metabolic imbalance, infection of the central nervous system, or high fever. These are all things that can by itself cause a seizure, but these are things that you can have that does not cause epilepsy. So the signs and symptoms of epilepsy is pretty broad. There's no single term to define epilepsy. It's considered a spectrum disorder because of the different causes and different seizure types by which region of the brain they originate from. So like I said, some of the common ones that you can experience would be the loss of consciousness, the muscular weakness itself, emotional symptoms, anxiety, staring out into like space, a focal seizure, contraction of the muscles and jerking, and confused speech. There are various signs and symptoms to look out for, but generally someone who can lose consciousness during a seizure. From asking my wife about her experience, after a seizure takes place, she experiences muscle weakness and confusion of what happened. It feels like a total reset of the brain. In the EMS world, we actually call this the postictal state, which is pretty typical of my wife's experience. So causes and risk factors. Anyone can suffer from epilepsy regardless of age, gender, or ethnicity. There is no single correlation of what and why someone could suffer from epilepsy. The disruption of normal patterns of neuronic electrical activity in the brain can vary from anything from structural damage, genetic disposition, infectious, metabolic, or immunological processes. Now, there are certain risk factors that can increase your risk of obtaining epilepsy, to include age of onset, as young children and the elderly are tend to be more at risk, strong family history, like I said, and sustained traumatic injury without protective equipment can change the structural integrity of the brain. Throughout the years, there have been numerous advancements in the diagnosis of epilepsy. The current classification model for epilepsy was established in 2017 by the International League Against Epilepsy, the ILAEE. This chart was first officially classified since 1989 and demonstrates the importance of dividing epilepsy seizures into the categories that I described as. It's important because it describes specific characteristics that can be understood by both the general public and by medical experts. The lesson learned, the current evidence-based practices allow for the continued process improvement as we navigate assessing, diagnostic, and treatment of epilepsy that can be done by everyone, regardless of what educational level. In conclusion, thank you for your time listening to me today. If you found this useful as we learn about epilepsy and understand the importance of how this disorder can affect everyday life without immediate medical intervention and treatment. Thank you so much, and here are my references.